we'll start off and formally welcome everybody to our Wellbeing at Home event. It's always lovely, heartwarming, as I say, to see our regular attendees to our Wellbeing at Home event. But I want to extend a special welcome to everyone who's come from the 10 health and fitness membership, because I know there's lots of people who've signed up for this event from that audience, and it's a pleasure to have you all join us this morning. For those of you who don't know me, I'm Stella Foti, and I'm the founder of Wellbeing Escape. So we're a specialist travel company, and during lockdown we started Wellbeing at Home events because we kind of felt helpless because people couldn't travel anywhere, and it grew and it blossomed, and we've created a lovely community, and now we do Wellbeing at Home events almost every Saturday with a plethora of different types of wellbeing experts, from doctors to specialist physios to yoga teachers to you name it, we do it, and it's very exciting. So welcome, and we hope you can join us again for future events, those from 10. So I think don't worry about microphones. I'm seeing some messages about microphones. What we're going to do is we'll leave, if everyone can leave themselves on mute, just to avoid any kind of interference and disturbance while Courtney's speaking. But what we're going to do is, if you have comments or questions, just pop them on chat. And what we'll do is probably at the end, we'll take all the questions and Courtney will answer them then. We thought about doing it as we go along, but Courtney's got a very extensive presentation to cover, so she'll probably cover a lot of the questions as she goes through her presentation. So we'll do it that way, and then at the end you can either put it in chat, and if anyone wants to actually ask their question at the end using their microphone, you can of course do that too.
Yeah, please do.
Yeah, that's brilliant. So to kick it off, I would like to formally welcome Courtney. Courtney, thank you very much for joining us on a misty Saturday morning. And so I mentioned 10 Health and Fitness for the Wellbeing at Home community. Can you tell us a little bit about who 10 Health and Fitness are and what you do, please?
Yeah, so 10 Health and Fitness is based in central London. We also have studios out west and out east, so we're 10 studios in total. And what we do is we are a private physiotherapy company. We run Pilates classes and Pilates one-to-ones. And we also have a circle of care where we work with certain professions like PTs and clinical PTs. So clinical PT is just basically an exercise physiologist who works personal training with certain conditions. So more commonly with things maybe like cardiovascular disease or cancer rehab. So it's just a little bit more specialized compared to general personal training. And yeah, we are based all over London. Like I say, I'm at our Fitzrovia studio, which is central Oxford Circus. And we see a variety in the physiotherapy studio, for example, of musculoskeletal injuries. So that could be your sore back, your sore neck, your sore knee when you've been running recently, a whole load of generalized injuries. But for me as well, I'm building into that women's health side of things.
Okay, wonderful. I mean, I remember when 10 started, it was Pilates, it was mainly Pilates, right? But what was so unique about 10 in those days is that they had the reformer equipment, that the Pilates reformers, which was quite rare in those. It's still actually quite rare.
Yeah.
So you have all the up-to-date equipment and all the reformers. So when you do Pilates, you use primarily the reformers, right?
Absolutely. So we have a reformer studio which fits about 10 reformers in, and it's a really nice way of learning your Pilates because it's not just one of these classes that you go in and there's like 50 participants and you don't really feel like you're getting that one-on-one attention. The instructor is so well trained to come around and make sure that you know what you're doing. If something doesn't feel right, they'll give you options. And yeah, the reformer is amazing. I highly recommend if you haven't tried it.
Yeah. So tell us a little bit about you and what exactly is a women's physio, women's health physio? How does it differ to a normal physio?
Yeah, I feel like it's still not, widely known about yet. So generally within my physio background, I qualified in Scotland and I've done some work out in New Zealand where I did my Pilates training. Since coming back to London, that's where I've been specialising within the women's health role. So women's health physiotherapy is more specialised treatment for women's health issues. So that could be anything from menstrual cycles to pregnancy to postnatal to menopause. It covers the whole range of female life events. Now, a general physiotherapist could treat a pregnant lady, let's say if she had back pain. The reason why being a women's health physio is a little bit different is because we have external training. So I have done more courses around pregnancy, treating the pregnant and postpartum lady, and also with female urinary dysfunction. So that means I can do a pelvic floor assessment through the vagina. And again, it's just opening up that world to the population, because I think a lot of people, if they have issues, they might just go to the GP. Now, GPs are absolutely fantastic in all areas of what they do. But the issue is they will probably then just send you to a physiotherapist to get better care. So if you can just come straight to us to begin with, then you cut that line out and it's just so much easier.
Right, perfect. Okay, well, let's get going and tell us about the pelvic floor.
Absolutely. Let me just share my screen. Fantastic. I think you might need to pass it over to me again, Stella.
No, you should be able to do it.
There we go. Got it. Okie dokie. So hopefully everyone can see my presentation at the moment. We're good? Yeah, perfect. Okie dokie. So as Stella mentioned, any questions, feel free to put it in the chat box so that you don't forget. And at the end, we can definitely address some of these. Hopefully you will be learning a lot more about the pelvic floor, what this is and how we can strengthen this area after this presentation. So as I said, my name is Courtney. Kendall is one of my lovely women's health lead colleagues. She's based at our city clinic, which is in Liverpool Street. So it's quite nice that we've got two kind of hubs where you can come to if you need to see a women's health physiotherapist, depending obviously on where you are in London. Okie dokie. So what we're going to be going through today is just generally what is the pelvic floor. So we're going to be looking at the muscles and the pelvis generally. We will look at the role of the pelvic floor, so why we need to use this, and of course how we can activate and switch on these muscles, and therefore the importance of it. And I think as well, just explaining why we need to be using the pelvic floor from a young age all the way through as we go through different life events. So pelvic floor dysfunction, particularly we'll look at the effects of being pregnant and the postpartum stage of life, and looking at common issues that surround this. And we'll also be looking at strengthening exercises, so particularly strengthening the pelvic floor, how to actually activate this correctly, and also look at some core and Pilates-based strengthening, because I think if you've ever been to a Pilates class before, it's always talked about. But again, if we don't know how to actually switch these muscles on, then we can't really get, anywhere with it. So we need to really know how to engage with this muscle group. Okie dokie. So with the pelvic floor, I think what people would normally describe this as is a base of muscles at the bottom of our pelvis, which almost sit like a bowl. It's a little bit more complex than that, and I want to separate it into the anatomy for you. So if you can see my cursor on the screen here, this is just, I'm looking down through the pelvis. So we've got our hip bones at the side, we've got our coccyx or our tailbone at the back, and then we've got our pubic bone here at the front. Sitting within like that bowl-like structure is our pelvic floor muscles. What we're going to do is just separate this into three areas to explain it a little bit further. So we're going to talk about the pelvic floor muscles as actually the pelvic diaphragm. This is really where the muscles are and where they sit. And like I say, they attach from the front of the pubic bone all the way around to the back of the coccyx. and they're sitting in that almost cylinder shape in order to contract and lift up the way. So the two muscle groups are your levator ani and your coccygeus. I don't expect you to remember these long names, but just for reference. Then we'll be looking at what we call the perineal membrane. So that is, again, at the front of the pubic bone here. The perineal membrane is just a fascia-like attachment. So basically, it provides an attachment point for the muscles to connect onto. And it's almost just like a fibrous tissue. And then we have our deep perineal pouch. So for females, that is where we're going to sit through the urethra, so where we're going to go for a wee, and also where the vagina is. So there's three separate areas. Obviously, our focus is going to be on the pelvic diaphragm, the muscles itself, but I just wanted to explain the anatomy a little bit further. As well, when we look at the perineum, this is a small little area between where the vagina and where the anus is. And this is an area that is commonly talked about more recently, actually, in third trimester of pregnancy. There's been some research done on massaging the perineum in order to basically prepare for vaginal delivery, because obviously that's an area that a lot of pressure is kind of put on. We'd be looking to see if doing some deep tissue massage on that region can help to loosen up that tendinous area in order to be able to push and hopefully prevent any sort of tearing through vaginal delivery. And it has had some really good evidence thus far. I think they recommend doing that from about 36 weeks onwards. So that's a little bit more on the anatomy there. Okay, and then if we delve into the pelvic diaphragm that little bit further, so looking at these muscles, again, I don't expect you to really remember all the names, but it's just nice to get a feel for where these actually live and what they do. So again, just to kind of get our bearings, we've got the pubic bone at the front here, and then we've got the coccyx and the tailbone at the back, and then we've got the bowl of our pelvic floor muscles in through the center here. So the urethra, where we're going to go for a wee, we've got the vagina, and then the rectal area at the back there. So the levator ani would be the biggest pelvic floor muscle, which helps to do the majority of work in controlling. It is split into three different areas. We've got the pubococcygeus. Again, all of these long words do mean something because it comes from the front of the pubic bone all the way back to the coccygeus. We've got the puborectalis and the iliococcygeus. So when I'm doing a pelvic floor assessment on a female who maybe wants to check the strength of their pelvic floor, or they're having some problems with any sort of leakage, I would be coming in through the vagina and then sitting onto the puborectalis muscle, and that's what I'd be looking for when I'm checking a contraction. So ideally, we're looking for almost a drawing up and through off that muscle to almost connect with my finger, which is quite a nice bit of feedback for the lady as well, so they can have that external focus in something to kind of draw up on. Then we've got the coccygeus muscle, which sits at the back here. So again, it's quite close to our glute muscle. So if ever you're coming to Pilates classes, you'll know that we absolutely hammer the core and the glute muscles. They're all in quite close conjunction to the pelvic floor. We want to still be able to isolate the pelvic floor muscles alone so that we're not overusing, let's say, the abdominal muscles or the glute muscles and almost cheating, which we can do quite easily, unfortunately. Okay. So why are we talking about pelvic floor and why is it so important? So again, just getting our bearings here, we've got the pelvic floor sitting at the bottom, spine through the back, and then we've got our diaphragm at the top here. When we are looking at the pelvic floor and why we need to do the strengthening, it really helps to support our internal pelvic organs. Also helps to support the abdominal cavity. So it's such an important area that it's actually working away when we're not even thinking about it. So subconsciously, the muscles will be simmering away and should be switching on if they're obviously working 100% and correctly. That means that as our bladder fills or our bowel fills, that the pelvic floor is able to resist any of that extra force. When you're looking at resistance, this also helps with any sort of external pressure. So if I was to go for a run, you're looking at the pelvic floor being able to fight and resist that strain. If we are coughing or sneezing, which is when extra pressure on the diaphragm presses down, and then that connection with the diaphragm pushing down on, let's say, bladder or pelvic floor, you want the pelvic floor muscles to be able to kick in and basically fight against that. It helps to keep us continent. Again, we want to make sure these pelvic floor muscles are working to 100% and full function. So that's both with the bladder and the bowels. And with enabling, the pelvic floor help with voiding, so going to the toilet. It helps with childbirth and with sexual activity. So it really is such an important area for us to be talking about and us to understand. And ideally, we want to try and get this into school age learning. I think there's a big push in order to tell young males and females from a younger age why we need to be activating these muscle groups, because again, you kind of maybe hear about it in an exercise class, you know, way down the line, activate your pelvic floor, and you're kind of lying there thinking, I've got no idea if this is what I'm meant to be doing. And, you know, whilst I'm also squatting or jumping on the spot, it's quite a lot to think about at once. So if we can try and get you to understand how to switch on these muscle groups first, then you should be able to transfer that into all other areas of life. Okay, so pregnancy is a biggie when we look at pelvic floor muscles. So mechanically, as we are growing throughout our pregnancy, particularly from that kind of second trimester into third, obviously, as the lovely baby keeps growing, there's more weight and pressure on you, your pelvis, and therefore on the pelvic floor. So just generally having that external weight bearing down on the pelvic floor, we're going to need the pelvic floor again to be that little bit stronger to fight any extra resistance. When we look at the hormonal effects which occur throughout pregnancy, there's lots of changes, as we'll know, throughout that kind of pregnant lifestyle. And with progesterone, this is what we call a smooth muscle relaxer. So the pelvic floor muscle tone is basically decreased, and it's a little bit kind of looser and a little bit more relaxed. So again, it's kind of something else that's fighting against us trying to keep things strong. This is trying to relax. So we want to again have that connection with the pelvic floor throughout our pregnancy. I also want to just make it clear that pelvic floor strength is super important, but relaxation is equally as important. Because if throughout your pregnancy, I'm telling you just to squeeze and keep everything as strong and almost as tight as possible, then it's almost going to create pain and be so contracted and so tight that we're not going to be able to relax the area. If we're looking at vaginal delivery, we want to be able to actually push and let go and bear down. So it's getting that balance, and that would be where I think coming to see a professional is really, really important, so you can get that full connection. Relaxing, this is a biggie that I hear a lot of females come in and say to me, you know, they're maybe in their second trimester, they've got really bad hip pain, and they say it's because their ligaments are really lax. We've got all these hormonal changes going on, and that's why they're in pain. Now, don't get me wrong, there are lots of hormonal changes, but relaxing just kind of takes the brunt of being the issue, and there isn't actually much evidence to suggest that. The relaxing studies that have been done have been mainly on rodents, so we can't really, you know, cross that over into the human population. And I think generally what we need to know is that relaxin peaks at the end of the first trimester and then also assists with labour. Generally, it's not due to one hormone being the issue, it's just generally throughout pregnancy that we are having these hormonal changes, and that's why we need to have more connection with our pelvic floor muscles, our core muscles, our glute muscles, and that's why I'm so keen on keeping my pregnant ladies nice and active throughout their pregnancy. Okay, so if we were looking through our childbirth, the main muscle that's going to have some pressure on it is the levator ani, so that first bulk of the pelvic floor muscle, which sits at almost the front of the pubis all the way around to the back to the coccyx. This is due to, if we're having a vaginal delivery, that longer push phase, there's going to be obviously that strain and stretch on the muscles. occur. With that, you can occasionally get some nerve damage as well, meaning that sensation and control of the muscle can be quite difficult after birth. So if we're then trying to say, right, on you go, get back on the pelvic floor, and if the nerves are a little bit damaged, then you might actually just not be able to feel or control and activate the muscle group again. So it's something that, again, I'd be recommending seeing a professional about. You've also got increased risk on the pelvic floor area with any sort of perineal trauma. So that would be most common within your grade 3 or grade 4 tears. So it's where the tear also comes into the vagina and sometimes into the rectal area as well. That can also happen if you're having an episiotomy, where the consultant will have to make a slight incision in order to assist baby coming out. And again, further effect on the pelvic floor would be any sort of instrument delivery. So that's using forceps or ventouse. Again, just having that extra force coming into the pelvic floor is, you know, a lot of work on that region, and that's where we would then be needing to get it nice and strong again afterwards. Okie dokie. So we've been talking about the pelvic floor muscles, the anatomy, and what this all means, and now I want to look at the kind of the opposite, so dysfunction, how common this is, so effects 1 and 3, and almost why this is happening. So pelvic floor dysfunction is a broad term used to describe a whole load of symptoms. So it might be bladder leakage, leakage from bowels, or passing wind when you're not meaning to. It can also encompass pelvic pain, pelvic organ prolapse, and painful sex. So I think all of these things, which actually unfortunately are very, very common, but maybe we don't know how to seek treatment or seek help for these symptoms. And that's where we really want to just push women's health physiotherapy to help in these regions. So most commonly dysfunction is happening because the pelvic floor muscles are weak. It can also be that they are too tight. So if I see someone who is feeling quite tense, or quite commonly in that athletic group where they're very, very strong and have very, very strong kind of glute muscles and core muscles, but actually that means the pelvic floor is so tight. It's a bit of a catch-22 because it's so tight, but it's actually weak. Because if it's so tight and it's sitting at that high level all the time, it's hard for them to relax and then get that full contraction. It's almost like they just work within this small, tiny little range instead of getting that full contraction. So that's something I'd like to discuss as well. So with dysfunction as well, we'd be looking at why this happens. And of course, I've talked through the effects of being pregnant and childbirth. Throughout menopause, as we age and hormonal changes occur again, that can be a cause. Smoking or having a high BMI and more abdominal tissue bearing down on the pelvic floor is something we would look at. Also doing any sort of heavy weightlifting. So even if I'm working my upper body and I'm using kind of heavy dumbbells and putting force overhead, if I've not got that correct control with my pelvic floor, with my abdominals, what might be happening is as I'm forcing weight up, again, that internal pressure bearing down, my pelvic floor has to be able to control. You also see this a lot in high impact kind of exercise. So whether it's your burpees, your high knees, those kind of circuit classes, that's a real common one, which is again a real shame, because I think if we've got leakage, then we're terrified to go to some sort of exercise class where we're jumping around or on a trampoline, which is meant to be fun and it's good for our fitness and it's everything we want to push. But what we'll see is we see quite a lot of females kind of wearing a long sleeve t-shirt over their vest top. They'll take the t-shirt off and wrap it around their waist because they're so worried that something might actually happen there. And you know, I think it's something we have to address and get you back into all the things that we do love to do. And then if we look at constipation, so if we are trying to empty our bowel in the incorrect manner, the incorrect technique, there's going to be so much bearing down on the pelvic floor again, because it's almost like that push phase. Throughout childbirth, you're going to be really, really putting a lot of force through that region. And very glamorous, but when I used to work on the wards and work with postnatal females, they'd literally just have their beautiful little babies, which was also a pro because I get to have a little cuddle with them when I go around and see them, my ladies. We would always discuss how to do a poo correctly. And I don't know if anyone knows, but basically if we are leaning forwards, it opens up our back passage by about 30%. So instead of sitting upright or sitting back on the toilet, you're almost closing down through the bowel. Whereas if you lean forward slightly, you're going to open up the back passage basically naturally. Then what you need to do, which is quite good if you have young children, is almost like a little stool and pop your feet on the stool when you're on the toilet, because again, you're then leaning forward, you've lifted up, and you're able to then almost rest your elbows on your knees. And from there, you're able to get a lot more natural force when you're, pushing basically and try to empty the bowels. I'd also like to say that obviously, generally, we don't want to have to be pushing. It should be a bit more of a natural passage, and looking at fiber, hydration, all of those kind of things to help with the diet and help with emptying bowels. But it's a very good thing just to be aware of, even if you don't have any issues with constipation, is actually just trying that position with feet up on the stool, elbows on knees, and then just going from there. It is much more pleasant and the better way to do it for our body. Okay, so moving on from that, if we were to have dysfunction and it was to cause some sort of incontinence, I want to just discuss why that happens and what this is. So incontinence, again, is a broad term for unintentional loss of urine, and it can also be of feces or of wind as well. So again, if we look at our normal anatomy here, this is our bladder, and it's controlled by the detrusor muscle. So basically, when we need to go to the toilet, the muscle will contract, that sends signals to our brain, and that's why we go for a wee. In a normal bladder, this will fill up to about kind of 80%, and then we'll get those signals that we need to go to the loo. We're able to go quite nicely, we're able to control, we're able to get that nice emptying, and then again go around with our day. If we were to look at urge incontinence, this is the type of incontinence that basically you're needing to go very suddenly and quite a lot throughout the day without knowing. So it's often my ladies that have been kind of fine on the train home. They walk home absolutely fine, and they get to the front door, and that mental realization that you're almost into the front door, the key is in the door, your brain starts to send off signals, and you almost start to leak at the front door, and you're thinking, I'm almost at the toilet, like I just need to hold it, and it's the hardest thing. Now that is just because, unfortunately, the bladder is contracting too early. So when the bladder is filling, it's almost only filling to sort of like 40-50%, and then it's contracting. So it's contracting too early, and we need to look at basically bladder control, bladder diaries, and how to better kind of fluid intake as well in bladder training. Stress incontinence is looking at that external pressure, which is creating a little bit of leakage. So again, looking at your running, your coughing, sneezing, I'm seeing that quite a lot, and it's just throughout the day, small little bursts, but unfortunately can cause quite a big amount of kind of leakage there, which is very uncomfortable because sometimes we don't know when a cough or a laugh or something is coming on, and it's almost like you have to brace to prevent that from happening. There's also what we call mixed incontinence, which unfortunately is a little bit of both. And again, we'd be looking and in the physiotherapy side of things that if this was an issue for you, again, it's a little bit taxing, but what I would do is send out a bladder diary. It's a bit of paper I've got in my clinic room, and it's 3 days worth that I get you to note. It's actually super interesting to see how much fluid you actually take in and how many times you are going to the toilet, because we can pick up some really bad habits. So a lot of males and females will tell me that they drink tons of water, which is great, right? Because we're always trying to get like 2 to 3 litres in. And what they don't realise, especially in this sort of like irritable bladder area, is that they're having 3 litres of water, but you're also having 4 cups of tea. So your bladder is almost being overloaded with so much liquid. We think we're doing the right thing because we're taking in as much water as possible. And we're told that's a really good thing, but actually we might just need to ease that back slightly so that our bladder can cope with a little bit less pressure, and then almost build it back up in a muscle training sense. So a bladder diary is super useful. Like I say, it's a little bit of work, but it's 3 days of just noting every time you have a drink and roughly how much this is. And it's also noting how many times we go to the toilet. The more complex side of that is what we do try and ask ladies to do is to get like a measuring jug, like just a kind of plastic one. And it sounds a bit funny, but you take that and you put it into the toilet. Okay, so it sits into the bowl of your toilet, so that when you're measuring your bladder diary, you basically are going for a wee, and you can sit on the toilet normally, let your bladder go, have a wee, and then you pick up the measuring jug, you see where it's at, and then you can empty it into the toilet and flush as normal. The reason we ask you to do that is if you've got like, I don't know, a cup or a measuring jug, and you sit on the toilet and you hold it underneath you, you're not going to empty your bladder naturally. You're going to be straining, and it's not a natural release, and it's also not good for your muscles. So we ask you to do it, and again, that kind of most relaxed sense, in order to get accurate readings. Obviously, these things are easier to do when you're at home, but it is a really nice way of measuring. So that's just something to be aware of. Okay, so looking from the pelvic floor dysfunction, and then just looking at seeing what effect that can have on our pelvic organs. So prolapse, again, is a very common issue, unfortunately. And again, I'll look at the normal anatomy. So we've got our uterus sitting at the top here, bladder around the front, opening to the vagina, and the rectum at the back. So prolapse is when either the anterior wall at the front or the posterior wall at the back starts to bulge into the vagina. It can also be the apex of the uterus, which is here, can bulge down into the vagina. Now, again, why is this happening? It's due to a range of different causes. So weakness, pregnancy, menopause, looking at all those little changes. And if we've not got that correct control or activation with our muscles, then we're even more high risk. So if I was to go into a little bit more detail with this, patients often kind of come through with certain symptoms like a heaviness or a kind of pushing down in the vagina, and that's what they feel, especially maybe on higher pressure like running or coughing, sneezing, those usual ones. So if we look at what a cystocele is, so this is the anterior wall prolapse. And basically what this is that the wall that supports the bladder bulges down into the vagina. Okay, so with that, you might see common issues, like I said, that heaviness pushing down, but you also might see recurrent UTIs, incomplete emptying of the bladder, also just looking at straining and not being able to go to the toilet as able. If we look at the rectocele, very, very similar, but it's a posterior wall prolapse. So the wall that supports the rectum bulges forward into the vagina. So same sort of symptoms, you're not able to go for a poo normally. You're looking at strainage, leakage, and lots of discomfort as well in through the vagina region. And then if we look at the uterine prolapse, that's just where the uterus is bulging down into the vagina itself, a little bit more of a complex one there. And with prolapse, we'd be looking at, again, pelvic floor strengthening in order to provide support, depending on what level it is. You know, this all sounds quite severe and quite full on when you look at it like this, but actually we can do a lot of support work with the pelvic floor muscle straining. And then we can also look at almost adding in basically external support, like a pessary, because that's going to help to just hold up any sort of pressure that's bearing down, especially, you know, females get this in certain areas of life, like running. And if they're desperate to go for a run, it might be that we put a pessary in for that run, gives that support. Then you get home, it comes out, and then we do our pelvic floor exercises later that night, for example. Perfect. Okay, so on to our pelvic floor strengthening. Ideally, we should all be doing this daily, even if you don't have any problems, any issues, because we want this area to be nice and strong. So when we look at pelvic floor strengthening, this is all advised by the NICE guidelines. So it's very, very high evidence-based. And again, it's always, if you've got any sort of urinary dysfunction or bowel dysfunction, the first port of call is physiotherapy. That is recommended by the NICE guidelines. So it's not that you go straight to medication or surgery, it's we want to try conservative measures first. So when we're looking at our pelvic floor exercises, if I was to talk you through the goal is to be able to hold a muscle contraction for 10 seconds. Once we've got that 10-second hold, we want to be able to repeat that 10 times. Now, this is gold standard, top tier, okay? If that's what you can manage, that's fantastic. If it's not, we obviously basically tailor your program to what you can manage, and we look at almost doing about 80% of that because we don't want to overload the muscle groups. So if we want to work our slow twitch fibers, the pelvic floor muscles that help to basically, if you're going out for a long walk for 2 hours, there's no bathroom around, you want the slow twitch fibers to be able to hold our continence throughout that day. You also want to be looking at fast twitch muscle fibers. So the muscles that kick in when you do cough or a quick movement happens, and then you've got those muscles to fire on in and again, prevent any sort of leakage. So we want to aim for a 10-second hold 10 times. We also want to be able to do that short contraction, which is 10 again, squeezing up and in, and then relaxing, squeezing up and in, and then relaxing. So it's not fast, it's not super fast, it's just shorter. So we've got the short control and then the long endurance hold. It sounds a lot, but it is recommended that if you've got any sort of dysfunction or incontinence, that you do need to do this 3 times a day. I promise you, when you get the hang of this, it honestly only takes a couple of minutes. And for example, with myself, what I'll try and do is doing it at a point of the day where I'm constantly doing that thing on the same day. So if I'm on the tube to work, I will sit there. I've got my mask on so no one can see me, like breathing through it or pulling funny faces. I will sit and I'll try and do my control as I'm sitting on the tube, because again, I've got the support of the seat underneath me. So I've always got a little bit of feedback, and then I work on my strengthening there. Now, as I said, if you might not be able to do a 10-second hold, you might only be able to do 2 seconds or 3, that's fine. We work on that and we build it up. So I don't want you to think that it's just completely unmanageable. When we look at 3 times a day, again, this is for any sort of incontinence that's happening. So it's research-based that you would have to be doing it 3 times a day for at least 3 months, and you are being supervised. That might mean a check-in with a physiotherapist kind of, once a month, let's say. If you do not have any incontinence, any problems, I would still be looking at trying to get your maximum in at least once a day, because I think that's manageable, and I think it's still very, very important to stay on top of, again, as we age, as things change, as we maybe start running or doing a different type of exercise, you want to have the strength there. If we've got basically weakness in our pelvic floor, we also want to look at how we can modify our lifestyle in order to assist with the strengthening aspects. So I don't know if anyone's ever heard of the knack. The knack is us teaching females to activate their pelvic floor when they do something that they know irritates maybe their bladder, for example, and it might cause a little bit of leakage. So it could be squatting down to pick up your 1-year-old. And when you're in that deep squat and then you lift up that lovely heavy baby, there's that bearing down on the pelvic floor and it creates a bit of leakage. It might be that when you go to cough, we get you to try and squeeze up and in through the pelvic floor, almost brace, but in a good way, because the muscles have contracted. and then you cough. And it's basically just switching on and having that muscle control when needed. If we are overweight, it's something we want to look at as well, because again, the external pressure bearing down onto the pelvic floor. Caffeine is a big irritant for the bladder. So again, it's looking back at that bladder diary that I talked about and seeing whether we can cut down from 3 coffees a day to 1.5, and it's not being constantly irritated, especially if you power all those coffees out in the morning. Then come lunchtime, you're going to the toilet about 5 times and just being super irritated. The good bowel habits, so I talked about that toilet training and basically the correct way to sit. Looking at exercise, so if I'm someone that's leaking every time I go on a run, but I run 6 times a week for 45 minutes, I maybe just need to look at adding in something else alongside that. So I might need to do some Pilates or some yoga or some strength and conditioning so that I'm not constantly putting that repetitive impact on my muscles. Smoking is a biggie as well, because again, it's that irritant and our muscles can't be quite as strong if we are kind of a heavy smoker there. So this is the gold standard of where we need to be. And then I want to talk through how we actually do the pelvic floor exercises. So again, it's always a little bit easier if I've got the female there with me and we can do the vagina assessment. We can see where your muscle strength is at. So we grade it on a rate from sort of 0 to 5, 5 being the best and the strongest. From there, the external pressure from my finger is quite nice as a stimulant to draw up and in, because you're almost using my finger as that feedback to squeeze against. And then we can look at timing you. So can you hold it for 10 seconds and can you repeat that maybe 10 times? Important to note that if you are doing the longer endurance holds, for example, 10 seconds, you want to then let everything relax completely, breathe for about 4 seconds and then repeat. Because if you're just hammering out 10 seconds, one after the other, your muscles are just going to be knackered and you're not going to be able to get that full contraction. So we like to start our patients in a sort of like lying back, knees bent, nice comfortable position. The other area to do it in is in the bath, because you are relaxed, you are leaning back, and then your legs can kind of be open and supported by the side of the bath, which is really nice position to be in. From there, most physiotherapists will describe it as basically you're trying to stop the flow of urine and any passing of wind at the same time. When you have that pelvic floor contraction, you're looking at the drawing up and in of the pelvic floor muscles. So almost from the anus right up and through to the vagina. There's so many different ways to describe it. The one that I have been getting some good feedback from recently is imagining you're lying back and you've got a blueberry right on the outside of your vagina. What I'm trying to get you to do is grab on that blueberry and draw it up and through. Once you've got that nice short contraction, we can then build on holding the blueberry, like I say, for up to 10 seconds. The next task for you to do is to do that whilst counting out loud. Because the amount of people I will see that I'm saying, right, I'm going to test you, we're going to try the pelvic floor squeeze, and I can see them just holding their breath, tensing up their face, shoulders are up here, and we just laugh because it's like, right, okay, first of all, get your shoulders down. Second of all, we're going to count out loud together. So going back to the 10-second hold, when we are counting and doing that hold, I will feel for them squeezing around my finger, and then we'll count out loud together, 1, 2, 3, and make sure they can, number one, breathe when they're doing it. And it's a nice way to get you to do that at home. Obviously, you might need some private time to kind of do that yourself. But like I said, when I'm on the tube now, I'm kind of just there and just making sure that I'm breathing rather than counting out loud. It's a good way to start. From there, obviously, we want to try to be able to then do our pelvic floor strengthening exercises in a variety of positions. So sitting, standing, and of course, when we're exercising. Now, there's no way that I expect you to be squeezing your pelvic floor muscles when you're on your 45-minute run. But obviously, the stronger we get it, the more that will be working naturally at that baseline level, and you won't have any of that incontinence happening. It's also a really nice position to do it in standing, because again, you've got that gravity effect, and we want to be able to do it in a variety of different positions throughout our day. So like I said, we want to be able to breathe through it, because when you work your pelvic floor muscles, so that drawing up and in of the blueberry, you also get a natural engagement from our transverse abdominis muscle, which is our lower abdominal muscle, almost right underneath the belly button. It's almost like a little V that sits up. So if I pull up through my pelvic floor, a gentle tightening in of my transverse abdominis also happens. So we don't want to be overusing our core muscle, but it does work in conjunction. So you're working your core every time you work your pelvic floor. You want to also be able to get that full relaxation of the muscle group after we've activated, so that we've got, again, that full contraction all the way up and in, and then all the way down, because we don't want to be simmering away at that level where everything's just too tight and we're scared to let go. That can be an issue, obviously, if I'm seeing someone with incontinence, because they're scared if they do let go that they might leak on me, on the table, on whatever. It doesn't matter. We've seen it all before. It's no problem at all. We'd rather you get that good connection with the pelvic floor muscles. Also, remembering to do them is obviously one of the hardest parts. That's why I said I do it every single morning when I'm on the tube to work. Don't get me wrong, there's still some times that I do forget and I need to do it at work or something instead, but a reminder on your phone, looking at doing it when you're brushing your teeth. I totally understand that this can be extremely difficult if you're trying to manage younger children, also working, traveling around. But if we've got any sort of problem or incontinence, it is super important to do it, because it really will help. So it's just looking at, can I put a reminder on my phone? Can I set an alarm? It's such an important part of our day. So I've now just got some exercises here, which this is one of my lovely clinical PT trainers. This is in our Fitrovia studio, and I got her to be a little model for me just to go through some basic Pilates exercises. Not so much basic, sorry, common. When we're looking at Pilates, and if we've got that strength through our pelvic floor, we also want to make sure that we are working our core, our glute, and generally around the pelvis as well. So to start with here, pelvic tilting. So this is almost a variation of a cat-cow stretch. So on your hands and knees, rounding through the back and then arching through the back. The reason Sky is doing it on her back here is basically to isolate the movement to her pelvis. I know it's a little bit tricky to see here, but basically she is lying on her back, and here she's in an anterior tilt of her pelvis. That means she's almost arching her back off of the mat. Now I'm asking her to do that to get that range and almost provide a little bit of a gap through her lumbar spine. From there, she then tilts back and almost presses her lower back into the mat here, and that almost gives a core activation and a pelvic floor lift at the same time. So she is working on her pelvic control, because of course if we've got an unstable pelvis, i.e. it's wobbling all over the place, we can't control where it is, and it's going to be difficult to then activate up and through our pelvic floor itself. So if I was to give out some pelvic tilts, I'd be looking at you lying on your back, hands on hips. A nice way to imagine it is that you have got a bucket of water around your hips here. And when you are trying to arch your back off the ground, it's almost like the water is pouring down over your legs. And then when you're pressing your pelvis down into the mat, it's almost then like the water is spilling over your stomach. And you'd be working in through the range of that 10 times. If we look at a 4-point kneeling hover here, this is her working her lower abdominal control and her scapula, so her shoulders. From here, she's in a 4-point kneeling position. And then she is making sure that she is keeping her back nice and flat. So the opposite of these two, she's not completely arched off the ground. She's not completely flattened down. She's in neutral. So the spine is in a relaxed position, which is primed to work the core. Once she's got that nice long aligned spine, I'm getting her to tuck her toes, and I know it's hard because she's in black there, but she's actually hovering her knees off of the ground. So if you imagine being able to get that prime position, draw up through the tummy and then hold, she's holding that for a good sort of 30 seconds or as long as she can. I'll be getting her to repeat that a good 3 times to work into shoulder strength and core strength. If we then look at the next common one, which is your glute bridges, this is where we're working the posterior chain, so the glutes and the hamstring muscles. Again, it works on pelvic control and actually being able to engage your pelvic floor and lift up. what I've got her to do here is squeeze through her glutes and roll her hips up to the ceiling. In this picture here, I got her to do this because it's very, very common. You can see that she's really pushed her hips and her lower back up to the ceiling almost too much. She's overextended her spine, and that's what I'm not looking for, okay? I want the spine to be flat and aligned, not curved, because all you're doing there is pressing your tummy up to the ceiling and not engaging through the core. You're going to hurt your lower back, okay? Then we've looked at some core work. So single leg extensions, a really nice way to put some pressure onto the lower abdominis. So that transverse abdominis muscle I talked about, it has that connection with the pelvic floor. We talked through this, and again, getting that sensation and seeing a physio was really, really useful for that connection with the muscle. But here, what she's doing is, again, making sure she's got that neutral spine. So she's not arched, she's not pressed down. She's engaging her lower abdominal muscles, and she's using that to control a single leg extension of her leg. If she was not stable in her pelvis or activating her lower abdominal muscles, you would see like a shift of her over to the right, or she'd be arching through her spine, and she'd probably get a sore back after doing about 10 of them because she's doing them incorrectly. And then just showing another photo of her doing it in a more advanced position with both legs up. So there's more pressure on the core. You've got to be able to control the lower back a lot more in that position. And then the added pressure of doing that single leg extension is even harder. Of course, we build this up as we go along, and it's something I would work alongside, each individual separately, so that it's holistic care and making sure it works for you. This is just a very, very small range of exercises that we obviously do, but I just wanted to give you some ideas for things that can be really useful to work into your pelvic strengthening. So just to sort of finish up here, I did talk about pelvic floor being too tight, because we obviously talk about it being too weak and not being able to activate. You can see the opposite. So too tight means that the muscle is activated and contracting at a level which is too high at a constant base. You might see this where someone presents with lots of pelvic pain, so around the front of the pubis or around through the hips. They've got painful sex. We don't want that to be painful. We need to look at why that's happening. If the muscle is already too tight and you've got external force coming in, then it's too much. Constipation, because you can't actually push down and let things relax. Looking at almost feeling like you've not emptied your bladder properly. So again, that full relaxation is not happening. And you might also see some tailbone pain at the lower back there. To start with these individuals, again, I talk about it being maybe those that do, high impact exercise, or they're constantly on the go, but it doesn't have to be just that. It could be that there's high stress in life or something else is going on. The first thing I would do with this is actually not going, right, 10-second hold, let's do it, let's get things strong. We need to focus on relaxation first. So I would look at deep diaphragmatic breathing, which is breathing through our lower abdomen. So not breathing through our chest, which we shouldn't do anyway, but breathing through our stomach and through proper diaphragmatic control. That's going to enhance relaxation generally of the body, and hopefully enhance relaxation of the pelvic floor region to allow her pelvic floor to come down and then be able to then work from a proper range. Okie dokie, so that's my main presentation there. I hope that was clear, and if there's anything that you don't understand or you want to talk through, then yes, Stella, I think you're going to just pose some questions to me possibly, but if you want to know anything else, then just give us a little shout just now.
Okay, great. Can we just stop sharing the presentation, please, Courtney? Okay, wonderful. So there's a couple of questions that have come in about HRT and hormones, and actually I think it's relevant also if you aren't post-menopause or are on HRT. There could be, and you're still having your normal cycle, there could be times of the month, for example, where your pelvic floor becomes weaker than other times of the month. But these particular questions, if we cover this, is about progesterone, because I know lots of people take progesterone as a form of HRT. And how does that affect their pelvic floor. I mean, we've got questions here about that, you know, our bladder issues, sneezing, you know, those kind of things.
So basically what effect HRT has on the pelvic floor and bladder control. So in all honesty, obviously the hormonal changes that occur, and the reason why we maybe want to go into HRT are actually to combat those hormonal changes and help assist with any sort of big droppages. So in general, it should be helping with your pelvic floor ability. It might be that we need some assistance with actually being able to activate the pelvic floor correctly. I also work with some really top consultants, so gynecologists, and HRT can be a topical region. So if we're lacking estrogen, you can actually get like a HRT rub, which you put on through the vagina. And again, that can help with pelvic floor engagement. So I would say that the HRT isn't the problem being it's causing pelvic floor weakness, but of course, unfortunately, that is something that can happen, and it's something we want to assist with through strengthening alongside the HRT medication.
Yeah, I mean, I'd like to share a personal story about that, because I have experienced that myself. And somebody put a question in there about Mirena coil, which I also have. It did bring out some issues around the pelvic floor. All it made me realize, actually, I wasn't even aware of them, but it made me realize that I just need to work it harder. I just need to make it part of my daily routine. And since I've been doing that, it's almost gone. So, but it is, I wouldn't say that you should stop your HRT because of that. I just
absolutely
bring more
not
attention to it, bring more attention to that area. There's another question here from Pam. The Pilates instructor I work with is qualified to teach hypopressive breathing, which I do 5 times a week. She says this is extremely helpful for PFD and mutually refers with pelvic physios. Yeah, have you heard of this? Is it something can you tell us a little bit about it?
Yeah, so again, it kind of refers back to that breathing control, because breathing is so subconscious to us, right? It's something we don't think about on a daily basis. So when I tell you to actually breathe through your stomach or to breathe through diaphragmatic control, for example, breathing in for 6 seconds, holding for 3, and then breathing out for 7, that feels really, really difficult. So I'd say that absolutely breathing control is something that is super popular within my treatment and within treatment generally of pelvic floor dysfunction. And I think it's very important, and it's great that your Pilates instructor is actually helping with that sort of treatment.
Yeah. Okay. So breath work is a specific type of breath work is very relevant to this.
Correct. Okay. Yes.
Sarah has a question. Very typical. Sarah, you're not alone. When she does, she leaks when she does HIIT classes and sneezes. She says when she stands up, she feels that she's able to contract much.
She's not able to contract when she's standing.
When she's standing up. Okay. Sarah, do you want to?
Yes.
Exercises contracting. I thought, I never thought about. I mean, just not doing it, which is obviously where I've got the problems. But just when I was standing, I can't sense anything's going on. It's really hard. But when I sit down, I'm like, oh, okay.
It's really, really hard, because in that standing position, we've got that, we've got less mind to muscle control. We've got the gravity effects there of standing, and then also kind of like, am I squeezing my shoulders? What am I actually doing when I'm here? You're absolutely right that you're going to have to make sure that you've got that pelvic floor control in a relaxed position, so sitting or lying down, and building to standing. Now, the other thing with things like that is this can be a little bit more detailed and subjective to the individual, but is actually obviously in a private scenario, standing up and doing something like inserting a finger and seeing if you can actually feel the pressure, because it might be that when you're just standing and nothing is going on down there, you can't feel any sort of control. But if you have the external force of a finger or something like the LV, which is a pelvic floor muscle enhancer, so that's something you can kind of squeeze onto and actually go, I am working these muscles. It's just at a lower level and we've got to build it up. But yeah, it's something that practice makes perfect, which is so frustrating, but I promise it does take time and it will work.
Thank you for that. I mean, that's tell us a bit about that instrument again, because Helen asked the question about what you can use. And of course you have the famous Yoni ball, made famous by Gwyneth Paltrow. I mean, what's
Mhm.
your view on that? And tell us a little bit more about what was the instrument you just mentioned?
So I talked about the LV, which is a pelvic floor
How do you
trainer.
spell
That is ELVIE.
ELVIE. Okay.
It
So
is extremely popular now in the pelvic floor muscle training world. They're a brand that also do like a breast pump, so it's very, very common postnatally, and they've done fantastically. And actually, between myself and Kendall at 10, we're running a campaign with LV, and why this is so important to have an external trainer for use, because like I say, if we've got that control of our muscle group, it's fine. But if you're not sure if you're doing it correctly, or even if you're seeing a physio, but when you get home, you kind of forgot what's going on, the LV is a small little trainer that you insert into the vagina. It has like a Bluetooth stick. It's all very neat, and it's really nice. Yeah, it's very high tech. It's very, very nice and small and compact. So you insert it, the Bluetooth connection attaches to your phone. So you then download the LV app. And what you do is, obviously, ideally, first of all, in a relaxed position, lying back in bed or whatever, and you try to squeeze the pelvic floor against the LV support there. And then what you'll see on your phone is almost like a lift up and through when you're squeezing, and then a line coming down. Now, they do all sorts of like fun games, like you're trying to go up, down, up, down. They'll try and get like control, like along to music, or I've seen hilarious ones of like you're a bunny and you're trying to catch carrots. Like there's ridiculous things, but it is good as a game to just train up. And it also is really good because it senses if you're doing it correctly. So if it feels if you imagine something squeezing against that little LV trainer, if I'm just squeezing my bum and not actually using my pelvic floor, it will sense that your pelvis is tilting and you're not doing it correctly. So it's very, very good. I think they're about 100 to 130 pounds. So I appreciate that it's not super cheap, but maybe in the long term, for some people, it is useful.
Yeah, I mean, that's a really good point. About how to do the exercise properly.
Yeah.
What do you think about the yoni balls? What's your view? I mean, for anyone who don't know what I'm talking about, the yoni ball, it's a jade ball. It's kind of from Asian and Eastern practices, cultures, and which is inserted into the vagina and held, right? What's your position on that?
I don't love that because it's almost like a weight, and you're trying to like fight against that weight. And if you've not even got the pelvic floor control to just hold in standing or in sitting, to have external force to work against, I think is quite hard work and not great to be kind of pulling down. Whereas the LV is almost just like a large tampon size,
right, in
a sense. So it's very easily insertable and easy to use.
That's really interesting. Thank you for that. Really interesting information. Now, the other question I had personally, but it's also come up, would you recommend using the core muscles? Now, this is interesting because I think people don't really know how to do that pelvic floor, because sometimes, I used to do this years ago. I used to contract my glutes at the same time.
Yeah.
And you shouldn't really do that, right?
No.
It's kind of isolating it, and it's that precision of isolating. So should you engage your core muscles?
Yes. So with that, what I'm saying, when you do a pelvic floor muscle contraction, naturally, if I'm looking at female on the bed and they're doing that pelvic floor contraction, I will also have one hand on the lower tummy. Okay. So that lower tummy, I should feel a tightening up of the muscles. So your lower abdomen should have that small contraction as you lift up and through, almost like a tightening, as if you're trying to fit on a tight pair of jeans or something. It's not a suck in, it's not a holding off the breath. It's just a small tightening up of the muscles. So I don't want you to think, right, all I need to do is squeeze my tummy, easy peasy. No, when you actually do the pelvic floor squeeze, you should get a natural engagement then off the stomach as well.
Right, wonderful. This is such an important subject, and one that isn't spoken about. And you've been, it's been an excellent presentation. Thank you, because you've really drilled down into the things that most people don't talk about. People don't talk about these, these issues that we have. So it's been really, really interesting. It certainly motivated me to do it more than once a day.
Yes, please.
And I realized actually my issue when I invested in a little trampoline, little trampoline, because I love it and it's a quick form of exercise. And then I realized that, oh my gosh, it's a bit weak, you know, like I'm aching a little bit. So then it prompted me also to work on that. But I think it's really interesting. So Courtney, if you can please, okay, I just want to answer some questions here. Yes, the recording will be available to watch later. And you just need to log into our website, basically, and under your login, because either you've come in via the 10 Health and Fitness, or if you've purchased come in, you'll have access to that recording through your login. You have to log into our website, which you should have received that login, and then you'll be able to see it on your account. So you'll be able to watch it afterwards. So it's good, you can refer backwards. So Courtney, if you can, okay, one last question here.
Yes. I'm seeing a couple
I'm
there.
assuming it's never too late to start these exercises. Actually, 2 last questions. That's a really good question. Really good question, because if you can strengthen it even if it's quite weak, and even if you're in your 70s or 80s, or you can still work on it, right?
Absolutely. You know, even like I said, with forms of prolapse, right, where the vaginal walls actually it's bulging down into the vagina, I think, yes, absolutely, we're not too late. It's something we need to start on. And like I said, even if you can get a 2-second hold and 5 short squeezes, that's where we begin, and we build it on up. So it's never too late. Someone also asked if one has
incontinence. She just said, is it good or bad to restrict number of times visiting loo?
So again, it's subjective because everyone's different, but I would say absolutely. I do not like, you know, people obviously have that fear factor. So if I know if I'm going for a 3-hour walk, I'm going to be like going to the toilet 10 times before I leave because I'm so scared that I'm going to then leak when I'm out on my walk with my friends. That's not great, because you're not allowing the bladder to fill appropriately, and then you're basically decreasing the capacity of what it can hold. So you're then telling it can only hold this like 100 milliliters when it can actually hold 400. So yes, there is it is kind of bad to restrict. It's bad to go too much, and it is good to restrict depending on how long that looks like and what it looks like for you. It is a little bit subjective.
Okay. Tanya, the squeeze app was the LV. I'll write it.
Yes, definitely recommend. Is the NHS app.
Oh, sorry, the NHS app. Sorry, someone mentioned apologies. The NHS app is called, from Tanya, she made that as a recommendation, called Squeezy. It sends you reminders to do the exercises. Fantastic. Thank you for sharing that.
Yeah, that's really, really good. It's just a little reminder.
Yeah. Would you recommend iTouch from Tenscare?
I don't know what iTouch is actually. Could you explain?
Helen, do you want to tell us? No, she doesn't want to tell us.
I'll just post a link on the chat.
There's so many gadgets and things out there these days.
Yeah, it's a gadget. It works similar way as a TENS machine would work.
Yes, of course.
But then you insert it. It gives you different sort of vibrations.
It's like muscle stimulation. Yes, sorry, I know the broad term of it. I don't know the specific makes. I know exactly what you're talking about.
Yeah, I just put it on the chat, the link.
Yeah, it's basically called muscle stimulation. So it's almost like using something like the LV. Now the LV is that external force which you're squeezing against to get that muscle contraction. If you are unfortunately very, very weak where you need assistance with switching on the muscle, you can use something called STIM. STIM, again, is that inserting small device, but what it actually does is it almost helps to power on the muscles by giving that little small electrical stimulation to actually activate the muscles itself. So it almost starts to recruit muscle activation without you doing the squeeze, or it starts off the squeeze for you so you can finish it. It's something that is really, really widely used, again, within pelvic floor dysfunction, and I think it is useful for the correct individual. So again, it's subjective.
Okay.
Thank you.
Listen, thank you, Helen, for that too.
Thanks, Helen.
I've had catheter twice this past year. Should I try holding them? Okay, Rachel or Raquel. I've experienced if I hold on for 2 or 3 hours and bladder doesn't empty anymore. So I tend to go very often, often better out than in. Yeah. I've had catheter twice this past year. Should I try holding on again?
Yeah. So 2 or 3 hours is quite a long time to go, and I think again it depends on how much you are feeling, like taking in fluid. So I don't think it's important. I think it's important not to hold for long periods, because again that's going to irritate your bladder and you need to be able to empty and then refill. So I'd be looking at probably, you know, trying to see someone about that, or kind of looking at a bladder diary for 3 days to track exactly what you're taking in and how often you are going. I think sort of once an hour to an hour and a half is fairly normal, but again, it depends on the individual.
Right. Well, Courtney, thank you so much.
You're very welcome.
Wealth of knowledge on this subject. Would you like to, if anyone wants to go and see Courtney individually, would you like to just share your email in the chat?
Yeah, of course. I'll put it here.
Yeah. If you want one-to-one information. And then you mentioned something to me about insurance, being able to claim visits to physios on insurance now for this particular subject.
Yes, so obviously we work in private healthcare. So if you have sort of any problems and you want to come and see me about it, then we do offer self-pay options. I was talking to Stella about private health insurance, because I'm seeing quite a few pregnant ladies right now who have insurance like Bupa or AXA or Cigna. They've got in touch with their insurance to say, I'm pregnant, I'm having this issue, for example, extreme pelvic pain or something like that because of my pregnancy. Can I go and see a physio for it? And they ticked it off and said yes. Unfortunately, we're having a bit of a fight within the insurance world, in the sense that, you know, some might say yes, some might say no. So if you say I've got urinary dysfunction, I need to see a physio, it's questionable and dependent on your insurance whether they will approve it. But I would recommend giving them a call if you do have insurance, checking, because it might also be that you've got lower back pain and you're seeing me for that too. You know, these things kind of come in conjunction. So try and look for the approval, and if you can get it, fantastic. And then you can see me for 5 or 10 sessions depending what they give you, and it's great.
Yeah, no, that's a good tip. Definitely a good tip, because it's a condition that, as we said, we don't really talk much about. It affects so many women, and it seems to me like it affects women around pregnancy time and post-pregnancy, and then around menopause and then post-menopause. It seems that's where the big spikes are. Maybe women have it throughout their lives. I don't know, but that's maybe I'm wrong. But that's what I'm the feeling I'm getting. Do you want to just share your email?
Yeah, I have put it there. So physio.com. Can you see it there?
Oh, it got lost in all these lovely comments.
Oh, hold on, let me do it again.
There you go. Okay. So
I think I sent it to one person, sorry.
Yeah, if anybody, just send it to one person. So if anybody wants to contact Courtney, you can do it at Physio. Well, thank you so much.
Yes, thanks for having me, guys. That was great. It's
really, really good. It's great. And thank you everyone who made the time, came along. And as I always say, it's great to invest time in keeping yourselves healthy and happy. Preventative health is the way to go, so let's do it. And I'd like to wish everyone a wonderful week ahead. Next week we have Colin back to do another Kundalini class. Kundalini yoga class. I will share details of that. And he's doing 2 Kriyas, one which is 7 steps to health, which is great. I've done these myself, by the way, so they're brilliant. And another one which is a Kriya for overwhelm, which is also excellent. But I'll share that during the week, so you can find that out. But in the meantime, have a great week ahead. Lovely to see you all. Thank you again, Courtney, and take care, stay healthy and happy. Bye, guys.
Happy Saturday, guys.
Bye.
Have a good one.
Bye. Have a lovely weekend. Bye.